He's gonna want it.
Well, he's talking off then. There he is.
Good afternoon, everybody. Can you hear me okay?
Yes.
Yeah.
Can we turn up? Oh.
Thank you, Lynn.
Is the owl turned up too high?
Oh,
Yeah.
yeah, that was a rude awakening.
Are we waiting on anything, Elin?
No, since this is not a quorumed meeting, we don't have RSVPs. So I think, people will join us as they get the opportunity. Otherwise, we'll try to stick to our agenda times.
Great. Well, thank you, everybody, for joining us then. We will get our meeting started. For those on the call who I may not have had the pleasure of meeting yet, I am Rorden Hart. I'm the mayor in the village of Trumansburg and your 2023 consortium chair. I have been a member of this board since its inception, and it's great to see the growth that we are experiencing as an organization, and certainly glad to see so many of you participating today. This is the first year that we've kind of done a two-part, if you want to think of it that way, a two-part annual board meeting. The work of the consortium that the board of directors will need to approve and move through will be at our in-person meeting next month, which you'll be reminded of a couple of times, I'm sure, this meeting. But the informational update, where are we, where have we been, where do we stand kind of piece of it, we decided to break out into this meeting tonight in the interest of time. At our regular board meeting next month, we decided not to include all of these updates next month, and we can go over it tonight. So again, welcome. We call it an educational session. I more think of it as, although it's certainly educational for newer members, it's really meant to be more of a kind of an annual report of where we stand as an organization. I'll cover a couple of things initially and then hand it off to Elin Dowd, who's our executive director. We do plan to cover a fair bit of information tonight. We have updates on 2023, of course. We talk about potential or hopeful new members that will be joining the consortium next year. There will be items for each of our municipalities to accomplish or to check off, so to speak. After our September board meeting, there'll be some follow-up items that each of our municipalities will have to do. We're going to talk about our prescription benefit manager. We have changed effective 2024. We will be changing our prescription benefit manager for a number of reasons, which we'll talk about later. We're also going to touch on the 2024 budget. There are a number of moving parts and pieces to this. There are a number of recommendations that we are going to have for our full board meeting next month as we look forward to next year. We had a couple of audits. Audits are a part of our life as an organization. We had an audit from the New York State Department of Financial Services, formerly known as the New York State Insurance Department, who likes to take their time and do their due diligence, if you will, in going through our records and whatnot. We also had a medical claims audit. This is something that we hire out to do so that we can have all of the medical claims that were processed by the consortium or processed on behalf of the consortium looked through to make sure there weren't any errors or omissions or things that could negatively impact our premiums or our subscribers. There are a couple of plan changes that we have on the slate for 2024. We'll be talking about Medicare Advantage plan options that will be available in 2024. We'll, of course, have a slate of officers and our various committee members, which will be voted on at next month's meeting, but we'll inform you as to what that proposed slate of officers looks like. We're always looking for more participation. We're always looking for people who are interested in becoming part of the decision-making process here in the consortium, who might like to raise their hand and say, as dry as insurance is, I'd be interested in learning more about it and participating in it. But we also understand that, especially as the consortium grows, not only in number, but geographically, that it is going to be difficult for a lot of our members to actively participate, either due to time or we all have our own kind of areas of interest as municipal members and participants. But I will just put out a pitch that if there is anyone who is interested in participating in a greater level, that we certainly would welcome your interest. We have additional benefits to discuss or touch on briefly. COBRA administration for anyone who's ever had an employee leave who might need to take advantage of staying on the employer's health insurance and pay the full freight themselves. That's of course what COBRA is. There's an administration component to that is not it's not overly complex, but it's not simple either. So there's an administrative piece to that we'll be discussing. Employee assistance program is something that we are looking to add as a value-added benefit to our members and our subscribers. And Lifetime Benefit Solutions is a large administrative organization that we'll be discussing, potentially helping us out with some of that. And we will have some time at the end for questions and feedback from anyone on the call today who would like to ask any questions or provide suggestions. As far as 2023 has gone, we have received Department of Financial Services approval to add Livingston and Monroe counties to the consortium's area of covered territory. So, of course, Monroe County, that's Rochester, Livingston County to the south. We are, if you think of a map, we are growing very far afield of the original inception of this consortium in Tompkins County, and I think that's a good thing. I think that the model of the consortium is something that we're the first of its kind. As most of you know, we're the first of its kind of this type of organization in the state. And of the success of the consortium has led to other areas wanting to join. That does present certain challenges, particularly when it comes to board of directors meetings, particularly when it comes to some of DFS's requirements of us as a consortium and in terms of member participation and whatnot. Again, because of the geographical growth of the organization. But from a purely insurance standpoint, when we are insuring the healthcare costs of our members and our subscribers, the more people you have in that insurance pool, the better off you are as an organization, the more stable your financial ups and downs will tend to be. If you imagine 3 people being insured versus 3,000 or 30,000, the more people you have involved, the smoother the long-term insurance volatility will tend to be. The consortium also this year entered into a long-term lease agreement to have our own very first own offices. We have been very graciously, the town of Ithaca has provided office space to the consortium for many years. Certainly since we hired paid staff for the first time a few years ago. But there's a number of reasons why we decided that office space wholly belonging to the consortium was appropriate. Not the least of which is we have seen a lot more employee engagement, employee questions of some of our staff. They sometimes will like to come and sit with staff members and ask questions. And there's a privacy aspect to that. So if we were able to find office space that was conducive to that, we felt that would be a positive thing. And we fortunately did find it's actually a brand new build out. It's on Upland Road in Cayuga Heights. So we hope to have future meetings there. Again, geography may make it difficult for some folks to travel to Tompkins County, but if possible, we will have the space to accommodate larger meetings and the professional office space that we will be moving into hopefully this fall will be something that can accommodate future growth in the consortium as well. And then lastly, as far as 2023 goes, we have had for a number of years requests from various municipalities at times to consider offering health benefits beyond simply the single versus the family. For financial reasons, it has not been advantageous to the consortium to offer the subscriber plus one or the subscriber plus child type of plans, but we're growing to the size and to the extent that it's something that we, I think, are going to have to offer at some point. And so we've begun evaluating, what does that really mean? What kind of a cost is it due to the vagaries of health insurance, and who is actually using health insurance benefits? Which plans cost more? Which plans tend to be the users of insurance versus the folks who frankly pay into the pool but never really use the benefits? And how does that spread out across the various plans? So we've begun to look at that. And I know that there are a number of municipalities who have not yet joined the consortium who are very interested because of our stability as an organization, but they have to be able to offer some of these additional tiered plans, some of it due to collective bargaining and some of it simply due to their desire to be able to offer it because they already do under their current plans. Before I hand it off to Elin, who will talk more about this slide, you'll hear, I think, throughout today and certainly at our board meeting next month about the consortium as an organization, about what benefit we really provide to our municipalities. You know, the village of Trumansburg is a very small municipality. We only have a couple of dozen employees. We have municipal members in this organization with many hundreds of employees. Why be a member of the consortium? What advantage is there? And I think it really comes down to two things. You know, when we parse through all of the kind of, as I mentioned earlier, the vagaries of health insurance, and we parse through all of the things that we might like or dislike about the healthcare industry, what it really comes down to as to why we should be a member of the consortium is two things. Number one, competitive rates. If the rates of the consortium were no better than what we could get in the open market, there would simply be no point of being a member. Our rates are very, very competitive, as you can see on this slide, and Elin will describe in further detail shortly. And the other thing is rate stability. If we could all, as municipal partners, sign on to knowing what our insurance premium increases would be for the next 50 years, I think most of us would do that. Of course, that's impossible, but we can do our best, and you'll hear more about it later in some of our planning for 2024. We can do our best to try to ensure that rates are as stable as possible. It's part of our mission statement to be able to provide stability in rates. It helps with our municipal planning. It helps with our municipal budgeting. And I think that's really the two biggest things. If we have competitive rates, which we do, if we can maintain that going forward, and if we have some semblance of rate stability, which we do have, and if we can try to ensure that those two things continue into the future, then this 12-year-old organization can happily look forward to being around for many more decades. And with that, I'll hand it off to Elin to get into the weeds a little bit more when it comes to the plan rates themselves.
Great. Thank you. Thank you, Gordon, and thank you everyone for joining us this evening. We're very lonely here in the Aurora room at the town of Ithaca, also known as our headquarters. But we have good snacks, so we're sorry you aren't here in person, but we are glad that you joined us this evening so we could share this information with you. As Gordon said, this is a great opportunity to not only talk about how are we doing, but what we are doing. So a lot of the agenda he went through is some of the stuff of what are we doing this year? How has it kept us busy and will keep us busy through the remaining of the year? But the big question about how are we doing? How are we performing? Gordon just gave a very big introduction to how we are doing externally. The other thing we look at is how are we doing internally? And we will have an update later this evening on how are we performing against budget. So looking at our plan, how our claims are performing, how are we performing against the budget we put together earlier this year is all key to measuring our performance. And we will get into a lot more of those details later. The other thing that Warden spoke about is externally looking at, you know, what are we really doing in the market? And as of now that DFS finally approved Livingston and Monroe, our territory is the same exact region as Excelis. So it's very easy for us to compare our plans to Excelis's community rated plans, our pricing to their pricing, and really just doing line by line benefit comparison. So there's already been some question of what's on the screen. So I'll talk a little bit about it, not dive too much into the details, but sort of understand. So when we build upon this, you'll understand the platform that we're standing on. When we started the metal level plans, we mirrored the metal level plans that Excelis was offering. Excelis also offers a ton of other metal level plans in each of the categories. So we compare against the plan that is closest to our plan, whether it's deductible or cost share or co-pays. So that in the gray scape is Excelis's plans that most match our plans and their monthly rates on individual and family premiums. They do have 4-tiered pricing. We did not include the single plus one or single plus child, because all of that is compared to our family plan. And then over on the left in the light blue are our rates, our monthly rates, where we are in 2023. So that's kind of the baseline where we're starting. Is the reason a lot of people call us and say, hey, I hear you can beat my current Excelis community rated plan. And we do have Excelis on the call with us today because they're coming up very shortly. And this is a very friendly relationship. They like our self-funded administrative contract. So it's not like this horrible competitive thing. It's how we work together. We have 2 totally different products that are out in the market, and Excelis serves us very well on the market that we have. So it's some good friendly competition, and we discuss it back and forth, but it also helps Losi and Cahill when they're doing a lot of the analysis for us of how we are competitive in the market and making sure we remain relevant to other benefits in the market. So later on, we're going to talk a little bit about our, I just went out. Is everybody still in? Okay. Later on, we're going to talk about our claims trending, looking at our recommended premium increase for next year. And we're going to compare that to what Excelis is currently doing in the market. They file their rates each year with the Department of Financial Services. On their community rated plans, they asked for an average 12% increase. And on their fully insured plans, they asked for an average 15% increase. So we are going to be discussing an 8%. And that goes back to what Warden said earlier about having a larger risk pool, being able to share that risk pool over a larger group. But it also has a lot to do with us building our reserves and having the opportunity to rely on our reserves. So we'll be talking about utilizing our rate stabilization reserve when we look at the budget projections and an 8% premium increase. Next. as we grow and as we increase that risk pool, we want to make sure that we are growing smartly, logically, and that our claims never outpace our premiums. So even though we're now in 18 counties, we don't have accounts members in 18 counties yet. We have the opportunity to do that, but we want to continue to grow carefully and strategically, balancing larger groups along with smaller groups, and making sure our demographics and the providers are all within the same area and continuity. So we are bringing on 5 new members, which account for 250 contracts. We will vote on them at the September board meeting. Those 5 members are in the white on the PowerPoint. So in Cayuga County, we're going to have Town of Brutus, Town of Locke, and Village of Fairhaven join us. In addition to that, in Oswego County, we're going to bring in the Town of West Monroe. And in Ontario County, our first member in Ontario County will be the City of Geneva. So those 5 new municipalities we will vote on in September. Right. So one of the things we've been talking a lot about this year is how we govern. And there are certain things that the board is responsible for doing. One is attending the annual meeting and voting on the budget, any plan changes, benefit plan changes, voting on the new members we just spoke about, voting on your officers who make a lot of decisions throughout the year for you. And some other administrative things must happen at the board meeting. In addition to that, you have a lot of responsibility in that last quarter of the year. And I'm sorry, I lost my screen, so I'll be reading off the large screen. In August, we're going to learn a little bit later about an EAP program that we are going to be having a shared service and pricing for our members should they elect to join that EAP program, Employee Assistance Program. So we'll talk about that a little bit later. That's the next meeting we're going to have October 30th at 10, if you'd like to send a representative to that. August. Thank you. I'm moving on to September now. September 21st, we have moved the board meeting to a luncheon. We're going to entice you with food to come and join us. We'll open our doors around 11:30 so people can get settled and have lunch around noon, and we can start on the agenda as early as 12:30. Due to open meetings law that we are supposed to have a quorum in person, we are moving the meeting to Greek Peak. So it'll be freeway, highway adjacent. I no longer live in California. So we hope you can all join us there and make it there and enjoy lunch. Right after that, we will have a benefit clerk meeting for your benefit clerks on September 26th for them to learn all about the changes and to kick off our open enrollment period. If you haven't let us know you're making any plan changes by October 15th, you won't be able to make them for another year. So we need to know if you're changing to a different plan. Excelis would really like to know by September 1st. So the sooner you can let us know, the better. We can start making those plan changes for you. We have an easy form for you to fill out and sign and send in. So after the board meeting, we'll also be asking you to sign the new municipal cooperative agreement that will go out after the board meeting in October, and ask you to send that right back with your resolution and signature. November is our open enrollment period from November 1st through 30th, when people can make changes without a qualified event. So that's the opportunity to add dependents, take off dependents, change a plan if they're eligible to do that. And that happens the month of November. We do that so in December, we can get new member ID cards out to you by the end of the year. So on New Year's Day, nobody is worried about whether they can fill their prescription or not. We'll have all the MCAs hopefully signed by then, resolutions from your municipality, and we'll collect those back. Just so we can start different processes in January. All of the plan changes take effect January 1st. Our new municipal members join us, but then we start sending out the code of ethics. And if you want to know, does the Department of Financial Services read and make sure you sign off on the code of ethics? Terry and I will tell you, yes, painfully they do. We also have some other reporting that's new, administrative reporting, that we will come to you and ask you for some information on your roster. That's going to happen by May. So those are all the things that are coming up. Most important thing is join us September 21st at noon. All right. The other cat out of the bag that Warden brought up earlier is we are strongly recommending that we change our prescription benefit managers to Excelis. This recommendation is coming from the operations committee. The operations committee looked at several different things in 21, when we did an RFP. We gave PROACT the opportunity to improve, and the operating committee looked at it again, did a scorecard, and felt that it was time for us to make a change. So we went back to our top competitor, Excelis, through the RFP process, and we looked at how they could help us improve. And some of the issues we were having in the areas where we wanted to improve was we were finding that some members were not getting prior authorization approved in a timely manner, and that was becoming very frustrating, where they felt they were unable to fill their prescriptions. We also had several members that their dependents were just dropping for no reason. They'd go to the pharmacy, they were told their dependents weren't covered when they were still on the Excelis system as being covered. There were other things that precluded our members from filling their medications in a timely manner. Also, when medications were filled and processed, there were inaccurate copays being either paid by the members or being charged, co-insurance copays, which resulted in reimbursement checks being issued. A lot of that was a result of accrual problems within the system. There were also some communication issues. There was some delays in proper benefit administration, where notices were given to PROACT to ask them to change benefits, and those benefits hadn't been changed in the system. Sometimes inaccurate benefits were being processed. And that was causing strained relationships between our labor groups and their governing municipalities. So nothing more frustrating than having a sick child, going to the pharmacy, trying to fill a prescription, and being told you either have to pay the full price or your child's not covered. Of course, they come back to their employer and say, you promised me I was covered on insurance, myself, my dependent, and it was causing a little bit of friction where the consortium had to step in and try to resolve the issue quickly, so all of our members can secure their prescriptions as intended. So that was what the operations committee was looking at. They asked for a new proposal from Excelis, an updated proposal to come in. Excelis spoke with our operations committee. The audit and finance committee then looked at the proposal and the pricing, and it went on to the executive committee, which is supporting our decision to move to Excelis in 2024. We asked our friends at Excelis to join us today to give a high fly of the proposal. We're not going through all the details that operations and audit and finance have seen, but to let you know what they feel they can do to improve services and give you the confidence that we've kicked the wheels and we are making the change in an educated and thoughtful, logical, analytical way. So with that, I'm going to turn it over to our Excelis team. We have our account manager here with us today, Brandon Holt. Brandon spends a lot of time with us. I'm sure we're his favorite client just by the amount of time he spends with us. He brought his team with him. The regional director of sales, Kelly Lasher, also loves it when we call her. Can't wait to pick up the phone because it's always good news. And then Amy, who hasn't had a chance to get us know us that well, but we're sure will. Amy Handelman is the director of enterprise pharmacy growth, the partner working with Excelis. So with that, I'm going to turn it over to Brandon and his team to share their presentation on being our pharmacy benefit manager.
Thank you, Elin. Appreciate the introduction there. I didn't know we were going to have pictures, and it's such a nice introduction, so that was very nice. I'm going to just share my screen here so you guys can see the presentation that we're going to be going over. Just let me know, give me a thumbs up when you guys can see that. Okay, should just be the cover page there of the deck.
We can see it.
Okay, perfect. Good evening, everybody. Thank you for the opportunity to have us on today to discuss our pharmacy benefit management and how we do that at Excelis, and what that looks like and the benefits that would be brought to the consortium and their members for choosing Excelis as such administrator. Elin already kind of touched on who's on the call today. I've been managing the Greater Tompkins account on the Excelis side since the beginning of 2022, so just going on 2 years. Amy Handelman, again, she's our director of pharmacy growth here at the organization. And Kelly Lasher, she is our regional director of sales and account management, strategic accounts, of which Greater Tompkins is one, and has been very involved with the consortium for the last few years as well. Just a little look at agenda and what we'll be covering today. It's going to be a pretty brief overview, but we'll take a look at our approach to pharmacy benefit management, and Amy will be handling that section. The experience that the consortium and its members and member groups should come accustomed to in terms of the pharmacy benefit under Excelis. Take a look at the transition or the implementation of the pharmacy benefit. And then lastly, our overall value of our partnership with the consortium. Amy, it's all you.
All right, sounds good. So good evening, everyone. I'm really excited to be here with all of you. So would like to talk about our approach. And if we move to the next slide. Okay, great, thank you. So let's talk a little bit about what we're bringing forth to the consortium. So we are truly a unique hybrid model where we are the largest regional PBM partnering with one of the largest national PBMs. And what does that mean to you and to your members? So we are local. We have pharmacists up and down the thruway, and we are providing that local support and that pharmacy strength, that bench strength to you. We are partnering with Express Scripts for a number of reasons. We partner with them from a negotiating power perspective, claims processing, as well as innovation. So from a local perspective, we have our own local pharmacists, and they are the ones that are working on the formulary, the step therapy, the use management programs, as well as customer service. So from a local perspective, when your members call in, they are calling local customer service. We are also driving to the lowest net costs. We have our own pharmacy and therapeutics committee, which is comprised of local physicians as well as local pharmacists. So again, it's our pharmacists bringing forth recommendations driving to the lowest net costs. From a national perspective, where we have that advantage is we work with Express Scripts, where we're getting that large negotiating power to get the deepest discounts and the greatest rebates that we can pass on to the consortium, as well as innovative solutions. So we can tap into any of their innovative programs where we can work with our local pharmacists, our local providers to make sure that we, again, are providing lowest net costs, trend bending, innovative solutions, and again, the most sophisticated model that we can provide to the consortium. So next slide, please. So let's talk a little bit about integration, where we provide real-time medical and pharmacy integration. We are providing a holistic approach by placing members in the center of everything that we do. This is a streamlined approach where they can coordinate their care through a single source, one care manager. On the left-hand side, with a carved out approach, this can lead to a fragmented silo system that jeopardizes member care, member experience, and can lead into an increase of costs. So evidence has shown with an integrated model substantially reduces costs, as well as putting some numbers behind it on the next slide. So let's take a look at the next slide. We're again looking at that real-time medical and pharmacy. With this view, with this access, our pharmacists and medical directors and care management focus on three key areas. The three key areas are preventing drug interactions, increasing adherence, as well as avoiding and reducing ER and inpatient visits. So these three items here is really where we focus on. Diabetes, we use that as an example for chronic conditions. This is where we're really focusing on increasing adherence. Specialty drug management, when you have 50% of the drugs that fall on the medical side, as well as the pharmacy side, it's very important that our pharmacists can view those to make sure that we're looking at that member whole picture to help guide the optimal care. And then as well on the preventing utilization costs, that's where you've got the ER visits as well as the inpatient visits. So again, having that entire view, that's where we can foster that data-driven results, that data-driven support, and then we can see the 4 to 6% lower overall costs when we take a look at those three items. So I know that was really quick, but I just want to make sure we're bringing forth to you really that real-time medical and pharmacy integration and holistically managing that member in the center of everything that we do.
Thank you, Amy. That's very, very concise kind of look behind the scenes at what goes on at Excellus and how we manage members' care and the pharmacy benefit, coupled with the medical that's already with Excellus. Next, when we kind of look at what the members and the consortium can come to expect having the pharmacy benefit under Excellus, I think this is where the consortium and its members will really see the most benefit in terms of interaction. What's nice about having the medical and pharmacy together is it's designed to work together as one kind of seamless benefit, even though it's two sides of the house, it's under the same roof. And they do work together. When it comes to the experience that the group can see, What's nice about this is the framework's already in place. The medical's with us today. So you have a dedicated account management team, which will be led by myself. So there's not a separate account manager. I will be handling both the medical and the RX, and have a whole team behind me to help support that. When it comes to administration on the consortium side, the financial billing, claims billing, all the pharmacy information will now be included. So that will be a consolidated approach, which will hopefully lead to ease of administration for the folks at the consortium, Terry, Elin, Kylie, that are managing things for the member groups on a daily basis. When it comes to communications and information and knowledge, all of that is coming from one source, from the group. So, you know, we're a one-stop shop in terms of coming to us. I have a ton of resources behind me, backing everything that I can go to, that we can pretty much clear anything up and get some information out there that's needed to the consortium. As well as reporting. Our reporting system is set up, so we'll just fold the prescription drug information right into that. The consortium, as well as the consultants at Loseed and Cahill, will have one spot that they can go to get all of the information, and that is some integrated reporting. So they'll see some updated and more beneficial reporting, since we have both lines of business. And then when it comes to state and federal guidance, I think as you probably are all aware, there's no shortage of that, especially nowadays. It seems to be just continuing to come hot and heavy. So we have a whole team that's dedicated to compliance and this type of guidance. And we use that team and those resources and that information to streamline that information, get it to the consortium. So it's one concise point of contact for that information. When it comes to the members, you know, obviously minimizing disruption, keeping members happy is going to be, I think, top of mind, you know, for all of us, not only here at Excellis, but as the consortium as well. What will be great for members is they now have the ability to access their complete healthcare benefit, medical and prescription drug, in just a single interaction. So what that will mean is the dedicated customer care team that is in place today already for the medical benefit, those same individuals would be fielding calls from your members regarding the prescription drug side as well. So members can call one number and get information that they need for both medical and pharmacy just in one single call. We have our mobile app, as well as a member portal online. All that information, again, will be in one spot. So one click and they can get both sides of the house and the information they need. ID card as well will have all the information that they need on it. And I think, you know, Amy kind of pointed to this a little bit when she talked about care for the member. That's going to now allow members to have that integrated care management, where if they are in need of any sort of management of their care, they're dealing with one individual from our member care management team, whether it be a nurse or individual like that. They have all of the information they need, both pharmacy and medical, to really get a complete picture of the member's care, take care of them, advise the member maybe on what they can do to improve their health with one interaction and one call. And we have a multitude of resources for which members can you know, reach out to those individuals and get that information and care that they need. We talk about the positive impact that would come from the change. You know, if you kind of think about, there's different pieces to the puzzle, and on the left side of the screen, you can kind of see that. Just in terms of logistics, there's a lot of things that happen behind the scenes, both on the medical and drug side. When the pieces of the puzzle aren't together, right, it's going to lead to maybe some less desirable outcomes. Elin touched on some of these that they've had in terms of a lag in enrollment updates, disjointed communication, members getting dropped inadvertently from coverage and having to be reinstated, accumulators not working correctly. Those things can happen when the pieces of the puzzle are separate. When you bring them together, and that's what it would look like under future state, is when you can hope to experience more desirable and optimal outcomes, where it's going to be more integrated, more seamless. You're not going to be dealing with some of these issues with logistics just because they simply don't exist when they're both with the same carrier or administrator. So We fully expect that those things that the consortium has been dealing with for a number of years would be gone with the move to Excelis. And then lastly, in terms of experience, not only from a logistics administrative service perspective, but also from a financial perspective, the consortium can expect to benefit from that. We feel like we've put together a very aggressive and very favorable financial proposal. And kind of just a quick overview of some of the things that we've put on the table. In terms of administrative fees, there's a lot of services that are just included in our administrative fee, kind of all in. We are offering a 2-month admin holiday for the first 2 months of 2024, where there will be no administration charge to the consortium for simply bringing the drug business over to Excelis. In terms of implementation, we're putting forth allowances for any sort of fees that may come with the implementation. If there's de-implementation fees on the PBM side currently, those costs would be covered. And we also have guarantees in place that are going to make sure that we hit all the milestones and checkpoints along the way in terms of implementation. If we don't, there are dollars at risk that would be paid to the consortium should we not meet those. We have a bevy of guarantees that we put in place. Again, some of those implementation guarantees, medical and pharmacy integration guarantees, as well as quality and performance guarantees. So I think we have about a handful of different guarantees that we've put out there, basically putting our money where our mouth is, saying that if we don't follow through with these numbers, hitting these metrics, the consortium is going to, receive financials for that. We're also offering a wellness credit, kind of outside of the RX benefit, but seeing as how involved and comprehensive the consortium's wellness program is and how it benefits the members. We're offering a credit for each year beginning next year to help the consortium really in any way that they choose to use those funds towards certain things to help members in terms of their wellness journey. And then lastly, and probably most importantly, is the rebates. So the prescription drug rebates that the manufacturers provide whenever a prescription is filled, those get passed back to the consortium, and we've put together quite a strong guarantee in terms of rebates based on our formulary that we think will very much benefit the consortium. And we also have many additional, programs that are aimed at cost savings, supplemental programs that can be put in place. And we are offering a pharmacy management fund to help pay for those programs. So kind of when you look at the whole picture in terms of financials, we think we've hit everything on the mark. We feel like it's attractive. We hope it's attractive, and the feedback that we've gotten from the consortium and Losi and Cahill is that it is. So we really look forward to, potentially having this relationship and the consortium benefiting financially from it as well. So when we talk about transition, right, change can be scary. A lot of people don't like change, especially the older you get, right? You don't want to change. You don't want to learn new things, but, feel confident in that we have the consortium and the members covered. We are proven partners when it comes to change. We have teams in place. That's all they do is implementations. That team is already in place and has been in place for the consortium. When we bring on new groups, we have a whole team, a dedicated implementation specialist, and we'll be folding in folks from the prescription drug side to help drive the implementation as well. When we talk about transition and the implementation, we focus on a few things, right? One of them is accuracy. So we're going to work with the consortium to make sure that we've captured all the pharmacy benefits accurately every step of the way, so that when we put them in place, it's the same thing that the members have been used to over the last couple of years. We confirm the network, any formulary disruptions that are going to be in place, that will be fully transparent to the consortium. We will notify members. We take that upon ourselves to let them know if there is any disruption, which we do try to minimize, that they're fully aware of it, and we give them the tools necessary in order to help manage that disruption or that change. comes the continuity of care. Again, we want to make sure that the members' care is not disrupted. Anything that they've been doing at the point of sale at the pharmacy continues to move smoothly. So what we'll do is request information and work with ProAct to get anything that they have on their system, bring that over to make sure it's a smooth transition. In the event that we don't get that from ProAct, we generally do, but we also have a contingency plan in place where we waive some situations for maybe the first 60, 90 days to allow members claims to come in. We identify those situations. We'll provide outreach to the member. If there's anything that they need to do, they have enough time to make that happen before the 90 days is up. So that way, when the time comes, they're ready to go. And just on the right-hand side of the screen, just a look at over the past 5 years, we've transitioned 23 groups in terms of their RX benefit, totaling over 46,000 members. 7 of those groups, so about a third of those groups, came directly from ProAct. So we have experience, obviously, transitioning groups to our pharmacy benefit platform, as well as experience going from ProAct to Excellus. So very familiar with how they operate, what we see from them, and successfully transitioning groups. Additionally, Greater Tompkins is unique, but not unique to us. We do deal with a bevy of consortiums, and we have a few on the screen here, some even in your area. TST BOCES down there in Tompkins County, who I also manage. So we currently administer both medical and pharmacy benefits for over 130,000 members total in 13 different consortiums. And some of these we've provided as references to the consortium, and I believe Elin and Kylie have reached out to those individuals to talk to them about their experience that they've had with us having both medical and pharmacy with Excellus. So they were able to hear kind of firsthand the experience that other groups have had that have been with us. Just so the proof is in the pudding, and it's not just coming from our mouths. So I said a lot. I said it fast. I'm trying to stay within the 15-20 minutes we have here. But we're just about to wrap it up. And to do that, I'm going to kick it over to Kelly to kind of take us home here.
Thanks, Brandon, and always happy to be with this group and appreciate the time this evening to really showcase the value of medical and pharmacy integration. I think our partnership with the consortium is very unique. It all stems around collaboration and how we support one another through this. So we're very excited to further our partnership by bringing medical and pharmacy together. We do feel that we are the right partner to be able to do this for you. As Brandon showcased, all of the consortium business that we work with, we really truly do understand consortiums. We understand the members, and we understand the bottom line that you need to abide by from a budget perspective. So, Brandon kind of highlighted pieces of that around the financial guarantees. Not only do we feel that through medical and pharmacy being integrated, bringing that significant savings to the table, we truly are bringing the greatest value from a financial position. We feel that financial position is going to give you greater holds on how you balance the consortium overall. And we're putting guarantees with that. So we believe we're giving the best value, but we're guaranteeing that for the consortium. So we understand the risk of that change. As Brandon talked about, that dedicated team that supports you and your members today is going to be in place tomorrow and continue to be in place through this journey. So those members are really knowledgeable, experienced, and understand the benefits of the consortium, and will understand those benefits from a pharmacy landscape as they continue to educate and answer questions as they're calling through the call center. We are going to treat that member in a holistic fashion, so really helping guide them through their entire healthcare journey, both on the medical and pharmacy side. As Brandon alluded to, we do this all the time. We understand implementation, and change is change, right? There could be hiccups along the road, but we have a process in place. We have guarantees in place to make sure we're hitting everything we need to as we work through this process. And we're hopeful that working with the consortium and working with LOCI, that through our data, we'll be able to better look at utilization patterns and trends to be able to balance the overall consortium bottom line. So with that, obviously, we want to be conscious of time. We appreciate the time today, and we're looking forward to furthering our partnerships, both on the medical and pharmacy side with the consortium. So we'll open it up to if anyone has any questions.
Thank you, Brandon, Kelly, and Amy for joining us this evening. We did have a few questions in the chat box. Obviously, the board must vote on any administration changes. They will do that in September, and then we'll start rolling out the information. But if you have any specific questions for Exelis, we'll take a few minutes to entertain them while we have them here. Okay, well, it looks like it looks like you covered it all. So we already have people signing up to transition. So I guess we'll be busy this week, Brandon, on our weekly call or next week.
So
I think this is
beyond this week, I think, yeah, as well.
Great. So thank you very much for joining us this evening, and thank you, Exelis, for putting together a very competitive proposal for us to be able to review and take on as the consortium.
Absolutely. Thank you.
Awesome. Thank you very much.
Thank you. Bye-bye.
Have a good evening, everybody.
So we are going to move on. I'm just going to take over.
You
Go right
go
ahead.
ahead, Chair.
We're going to move on to the 2024 budget recommendations, but first I want to go through the 2023 year-to-date performance and where we stand with numbers. So we're getting a relatively high level look at our income on this tab. And just to explain real quickly, our adopted budget is what the board voted on last year at the board meeting. We do an amended budget once we know who the new members are that are coming on and how much their premiums are going to be and estimate claims. And then the year-to-date budget figure is a calculation based on 7 months of actuals. So then it shows where we actually are for 7 months and then the variance and the percent difference. So our premiums, we are running just a little bit light versus our budget, not even 1 full percent, which is pretty good. Interest is coming up finally, as everyone knows. So hopefully we will get to hit our budgeted amount when we get a little farther into the year. RX rebates, we've gotten 2 of our quarterly rebates to date. We have gotten the 3rd, but it won't show up in this file until it potentially could be there next month, but I don't think you're going to get August numbers. So in total, we're about 0.75% below our budgeted 2023 budget. There we go. On income. So if we go to next. So this is going to be our expense size that we've taken at a higher level. So all the paid claims are added together. All of our claims administration fees are added together. We've got the same columns listed. So right now our actual paid claims are trending about 4% higher, and that would be total claims. So that's medical and prescription added together. Otherwise, we're running below budget, which is excellent in this case, since majority of our money is going to be in claims. So we're trying to cover it, but we are still at a net income of actually a net loss of 1.9 million. So we've got we've got to make up some ground. Should be budgeted at $725,000 loss, so we're kind of in the negative right now from where we should be for the year-end budget of 2023. So if we go to the next one, so this is where Bossier Cahill does do these charts. So this is comparing our actual claims to our budgeted claims. And it's going to be the top left is the medical and the bottom right is the prescription. So in both cases, we are running higher than our budget, which is what that last part in expenses told us. We are 4% high. So unfortunately, claims are kind of our detriment in 2023 right now, which is going to move into our 2024 discussion shortly. 2023 net income, liabilities and reserves. All in all, we're doing, we're net under on expenses. We're under on income. We do have these additional gains on losses on investment. We do have to do them mark to market as if we were to sell everything at the end of every month and take the losses and or the gains. That's what these numbers are, the 389 and the $8,000 loss. So if we adjust to our net income, we're still at $1.5 million in that case in loss. And our ending balance would be our assets. So as far as the reserves, we're right now, for 2023, we are hitting all of our requested percentages. So IBNR and the surplus are both mandated reserves. One's at 12% of incurred claims and the other's at 5% of the premiums. Rate stabilization reserve right now is a discretionary reserve, so we can change percentages, change dollar amounts, do what we need to do. It's not governed by the DFS. 7.5% of paid claims right now, and catastrophic claims is a calculation based on anybody over 500,000 in expenses and less than $1 million for claims. Is where with some other little tweaks. And Excellus Blue Cross Blue Shield Advanced Deposit, right now they have $928,000 of hours, which for 2023 would be 1 week's on average, 1 week's of medical claims is what's in there. For 2024, we will have to increase that to include the RX fee. So that will hit us in 2024. So we are at 14.56 is the percent of unencumbered fund balance over our premiums. Okay. Oh, that is, is Judy.
All right, thank you, Terry. A quick high view on our 2023 year-to-date performance. I'm going to cover our premium increase for 2024. The Audit and Finance Committee has spent the last 2-3 months anyways, looking ahead towards 24 and then into the 5-year projected. One of the things that we look at every year is our mission and part of our strategic goal is to try to keep premium rates stable. Rorden talked about this in the beginning. That's one of the founding aspects of how we began. This chart that's in front of you now shows what our average increase has been since we began in 2020 or 2011. We've had a 6.12 in average increase over that time. We try to look at a 5-year right now is 5.3%. These do not take into consideration that the premium holiday that we had in 2020. Where we are at for our premium increase for our projected budget for 2024 is an 8% increase on premiums. We do know that may be a little sticker shock for some people since we've had 5% and then 6.5%. But as Terry had just gone over in our 23 budget, we have definitely hit a year where we are spending more money on claims than we had budgeted. Our trending, can you go back 2 slides? I'm sorry. The trending model that we use while we're setting the budget is we're looking at these claims versus budget. As you can see, our total claims are 4.13% above the budget, so we are looking at those trends for medical and RX. We do know that RX is becoming more and more expensive drugs coming on the market, and we're having to deal with that in the budget. That is why we're looking at an 8% increase for the 2024 budget. And then moving forward, we're still looking at a 7.75, 7.5 kind of range for that. But we're being very cautious on the where our claims are gonna go. Is that good? Okay. And with that, we have decided, as Terry talked about, we have that rate stabilization reserve. That is a discretionary reserve. We've spent a lot of time figuring out the catastrophic claims reserve, how we utilize that reserve and fund it again. But the rate stabilization reserve, since we've had really great years and being able to have 5% and 6.5% premium increases, when we were looking at the budget for 2024, we were actually looking at above 8%. So one of the things that the Audit and Finance Committee looked at is how do we use this rate stabilization reserve that was at 7.5%. So at this point, the committee is recommending on to the executive committee to use the rate stabilization reserve. We have created a plan on how to use that money, how to refund that money over time. And that was we were able to bring the recommended budget increase from 8.5 down to 8. So that is one of the major aspects that will be happening for the 2024 budget. Anything else you'd like to add to that?
No, you're doing great.
Okay. Any questions on that piece?
But you know who's gonna have a lot to add to that is Paul. When he starts discussing our budget now. So I think we'll have to stop sharing our screen and bring it over. And when you visually see the utilization of the rate stabilization reserve in Paul's spreadsheet, I think it'll make more sense at that point. So with that said, we'll turn it over to you, Paul. And for those of you who, I think most everybody has met Paul, but Paul Pelton is with Losi and Cahill and has been working very closely with Terry and myself and the Audit and Finance Committee on creating this budget for next year.
How's everybody doing this afternoon? I'll try to move through this quickly, but yet not too quickly where I just kind of go by some big details without giving you a good explanation of them. First of all, everybody can see the screen, I hope. It looked like I shared okay. All right, very good. Okay, so the first thing obviously is, the starting point. Right here, we're going to give you some information based on 2022 through 2028. Again, the main focus of the conversation is going to be this column right here. That's going to be the 24 recommended budget, but what we need to do is make sure we got the right starting point. So this is the year end, December 31st, 2022. Just to give people a look at things, 10,591,408 was our undesignated fund balance. And where that is, the treasurer's reports, 10,591,000, audit report, 10,591,000, our budget document, 10,591,000. So obviously the right starting point is the key to developing a successful game plan, especially when times are tough. As Terry mentioned, we have a projected budget field, an amended budget field. Obviously, the projected budget was what was adopted last year prior to adding new members to the group. And then what we do is we take this amended budget and where we are to date, we look at our expenditures year to date and our revenues year to date. And in this column right here, we try to project forward where we're going to be come December 31st, 2023. Very difficult, obviously. There are some assumptions made. Obviously, we talk a lot about it. I'm going to talk a little bit about it moving on. you have these large losses that tend to hit from time to time, and there is no guarantee when they're going to hit, who they're going to hit, which municipality. So obviously, we're making these projections based on a lot of years of data, a lot of years of trend, a lot of years of history. But again, there is unfortunately no guarantee to the amount of claims. We obviously have a much better look at the revenue side of things. We can really kind of project a decent number for RX rebates. We obviously can project a very good number for premium income, but the two categories which are highlighted in green in this column, those are the crapshoot a little bit. Again, we have a lot of history. We use a lot of knowledge. We try not to panic in bad times. I guess I would say this year there've been a little bit of bumpy times. August has been a little bumpy. So we'll get into a little bit of the numbers, where we are and where we think we're going. And then I'll touch upon, how I think some of the large losses this year are playing a role in what we're looking at as far as that net income loss that Terry was showing you through July and where we projected to be at the end of the year. And then where Judy talked about how we're going to utilize the rate stabilization reserve to try to soften these premium increases and have a balance between trying to be conservative on the expenditure side, yet raising enough revenue and offsetting some of the pain of a difficult budget year. That's why these reserve funds, these discretionary reserves were put in place, the catastrophic claims reserve, the rate stabilization reserve, they were put in place for a purpose. And this year happens to be one of those reasons these reserves were put in place. So I'll get into a little bit of the numbers and just kind of walk you through. And again, remember when we're building the budget, we're building it based on current population. We're going to amend the budget again once we add the new municipalities. We'll figure out what their premiums are, their plans are as they're coming in. And then we'll come back to the group and we'll amend the budget in like February, early March, that time frame, and we'll be moving forward from there. So once we close the books on 2023, get through that whole process, and we'll amend that once everybody's up and running and hopefully hit a good target number. Right now, we have budgeted $62,109,000. We expect to receive about $61,627,000 in premium revenue this year. One of the biggest differences from the January to March, there was a shift in the number of family policies versus individual policies. We had a drop of roughly 30 family policies and an increase of 40 individual policies. Obviously, individual policies are a lot cheaper. There's only one person being covered, so that's on the revenue side. Obviously, the claims are the claims. Obviously, if you don't have a family policy drawing claims, you're not going to have the claim side going up as fast either. But one of the big factors there, besides people making shifts in plans into Medicare Advantage plans and that, we're just the shifting between family and individual policies. So we are going to run a little deficit there. So when we budget over next year, we're looking at $66,557,000. We are really budgeting off where our plans stand as of today. So again, not new groups, not what we projected back then, but where we stand of today, we're building an 8% increase off of our premium revenue as of today. Interest income, as Terry said, this has been a break to all municipalities, school districts. The markets are bouncing back. I'm not quite sure if the interest income is offsetting the expenses everybody is feeling elsewhere, starting to trickle into the health market. But it is nice to see interest earnings that are really being enhanced. If you look at next year, we have an $800,000 budgeted, which is a big increase over this year, but we did work with Wilmington Trust to generate that number. They're very confident in that number. We did tick it down just a notch over the outlying years. Again, we are focused on this year's budget, and next year's are just really placeholders, because when you build a budget, you can't really just look at this year. You got to have a long-term game plan. And especially when we're starting to utilize reserves, we want to get them refunded again. So this is that long-term game plan that we're talking about for 5 years, and to get our reserve funds back to where we are, because we are recommending that we utilize some of them this year. RX rebates. Again, Excellus talked about their enhanced RX rebates, and it was a very nice guaranteed rebate number that they're providing us. The one issue with rebates is they are coming in on like a 2-quarter lag. So while we have strong RX rebates, Excellus actually projected them to be about $5 million roughly, which you're going to start seeing in these outlying years, 4, 7, 5, 5, 5. And they may grow, because every year they tend to increase their guarantees. But this year, what we have is we're going to actually, the first 2 quarters we receive in 2024 are going to be based on this year with PROACT. So we got to budget accordingly and make sure that we don't dig ourselves in a hole by getting a little ahead of the curve on the rebates. So the first 2 quarterly payments would be based on activity with PROACT from the last 2 quarters of 2023. And then the last 2 quarter payments we get will be actually based on the first 2 quarters of 2024 under the Excelis agreement. So that's why that number is not at 5 million. We want to move it up. We think this 3.875 is conservative, and that'll give us a good revenue number of 71,232,000. Looking where we are claims wise and where we are budget wise, this has been the little bit of a albatross this year. Each week we get our weekly claims, we open them up and hope for good news, and it's just been a bumpy stretch. But when we build the budget, we also want to take in mind not only Greater Tompkins County's history over 10 to 12 years and what type of claims they had, but what have all of our groups in the area been doing? And we utilize that and try not to panic. For example, back here in 2022, we only had $37 million in claims. That would have really generated a budget if we trended it at 475 of around $39,100,000. So we didn't utilize that because that was kind of an abnormally low number there. So, you know, we still trended off a budget number because it did come in a little bit light compared to what we thought it was going to be. We budgeted accordingly. And then we moved up for the 2003 amended budget once we added the new partners. Unfortunately, even though we believe that number was very conservative, we're looking at this come fiscal year end projected. Obviously, this is only through July. We're taking the numbers. Actually, this is through mid-August. I took the numbers. We have a couple more weeks of history now since this document is put together. They have not helped the situation. They haven't hurt it dramatically, but they haven't helped the situation. So some of you may wonder, okay, why are we already off $1.3 million? And I'm going to talk a little bit about the catastrophic claims reserve that Judy and Terry mentioned. To date, and as of June, and this still a month behind, the reporting is a little bit of a lag. Back in 2022, we had 21 large loss claimants, and I'm talking only about people who had claims that exceeded $100,000 or more. On those 21 claimants alone, we spent $3.6 million in 2022. Interesting enough, that numbers actually went down. We've only had 19 of those claimants as of June 30th, 2023. The issue is for those 19 claimants, the total claims are 4.56 million, almost $1 million higher for 2 less claimants that exceed $100,000. So like we say, you know, when we're building budgets and we talk a lot of times, you know, unfortunately, we work with multiple municipal consortiums and cooperatives, and it seems from time to time, every one of them has one of those years, and we think that this is just one of those years. And there's also a little bit of, you know, the medical world's getting more active. You know, I think 2021 after COVID was a hesitant reopening. 2022, they're gearing up. And I think in 2023, you know, those elective surgeries that might have been put off, those things that need to be done are getting done. So we're not going to panic when we build the 2024 budget. Typically, what we would budget for medical claims is about a 4.75% increase. Really, Greater Tompkins County over the last 12 years has averaged about 4.3% increase on medical claims trend, and all of our groups put together just over 4%. So to be conservative, we do about 0.75% higher than that. We're not going to budget that off of this number here. We're going to take a little bit of a bet based on, you know, there is a cycle, you know, some of these things are cyclical, and every once in a while you do have that bad year, but we are budgeted fairly close to 4% increase over the estimated actual number. You know, so we're not quite at 4%, but if you go budget to budget, you're going to see that our expenditure line item is up 6.68%. And when you go over here, our estimated actual, we're actually projecting that we're going to be 2.95% over budget at the end. Right now, we're only 1.61% over budget. So again, we're trying to be conservative, not panic, and not overstate things, but also be cautious so we don't have a bigger hole when we're having this conversation next year. So we're kind of really trying to tackle it from both ends with reserve funds, and you'll see how that works at the end. Terry talked about the cash advance number. The cash advance number is basically 1 week's of claim, and she said that that's going to need to go up because of us bringing the RX under one roof. Again, Excellus, you'll see down here, we have that administrative holiday for 2 months, which was part of their proposal. That's fantastic because we're going to have to, while it's still our money, we're going to have to give some of that administrative holiday money right back to them and increase our cash advance number to about 1.3 million. So that's why this number's up for the 1 year. That's to bring that whole book of business under Excellus. You'll see that we'll have to increase our cash advance account, which is basically prepaying them so they can pay our claims until they bill us and we reimburse them. So it's just really a cash flow item for Excellus. Then we think it'll tip down, back around 175,000. Again, focusing on this year only, trying to get through this year. But then in the outlying years, we'll just do our typical increases. RX medical claims, we've been trying to get ahead of the curve here. And right now, you're going to look, we're projecting 20,294,000, and we're really going to increase that pretty much by a whole 7.5%. Now, how do we use 7.5%? We believe that's a conservative number. When we look at all of our groups that we work with, they've been averaging about 7.4%. Greater Tompkins County actually over 12 years is averaging only 6.34%. Yet we've hit a bubble that, it could be an anomaly. But again, we have to be conservative. With 7 months in the books, we're 8.02% over budget. That's where we're estimating actual because we had a bad month in July. As of July, we're actually 10.16. We think there's a couple of anomalies in there. So we're not going to, panic and think that that's going to be the whole year. But when you look at budget to budget, our RX drugs are 15.32%. Another thing that's not being taken into account here, because it's another hypothetical. In the proposal with Excellus, they fully believe in what they call their pharmacy integration savings. By bringing the pharmacy and the medical under one roof, they believe strongly that there's going to be some significant savings in our claims. So strong that they are willing to risk up to 10% of their admin fee if they don't hit certain targets. The problem is that measurement period is from 2024 to 2026. So you can't budget on that money. You can't plan on that money. But I've never known Excellus to put a guarantee in place that they don't really realistically think that they can hit. If they show that our savings, and they're only going to include claims, which the vast majority of our claims are, that max out at 150,000. So they're anything over 150,000, that's going to be excluded from the calculation, and that's probably fair. We don't have a lot of those that exceed 150,000 every year, but they do put a damper on the bottom line. But for example, in their proposal, if our claims over that 3-year period do not exceed a 1% savings, they're going to refund us 10% of their admin fee. So long story short, over a 3-year period, that could be $500,000. But unfortunately, that's going to come in this 2027 year, once we do the reconciliation through 2026. But it does give you a little bit of hope when you're looking at these claims saying, okay, if this integration thing is the real deal, these claim numbers, we're trying to be conservative and not panic, but maybe there's a little bit of over conservatism there, I hope. RX clinical concierge fees, that's a separate portion. It's a separate program. It's a buy-up program. This is a good deal because if they don't have the savings, they basically issue us a refund. So they have to demonstrate that they saved $166,000 in clinical concierge management in order to be paid for it. If they don't save that money, they reimburse you. The medical admin fees based on 3,400 contracts roughly right now, again, just current population. Next year, you see that number is going to drop down. We project it to be at 1.7 million. We won't pay for 2 months next year, so 1.38 million. But again, keep in mind, we're going to give a portion of that back to them up here in the cash advance. Clinical concierge fee, I went by the Canna RX. We still do have a small population of, or a small amount of prescriptions that go through the Canna RX program. That's going to run as it will be. Excellus relationship, they'll develop that with Canna RX. They'll work with that. ProAct actually did that piece and made that fairly seamless for the few people that utilize. Our covered lives assessment and New York State covered lives assessment, that's a New York State tax. You can't get around that. PCORI fee, can't get around that. Supposedly there's an end date for PCORI, but it seems like every time that end date gets close, they extend it out another 5-6 years. So we're going to keep budgeting that for the next 5 years. Getting down to the stop loss line, and this will be the last line that I spend a lot of time on. The rest, they're important, but they're really internal administrative fees, consulting fees. They make up a very insignificant portion of your budget. I guess the one thing I would say about those right now, this group runs in a very efficient fashion. The vast majority of the premium income brought in, I'm trying to pull up another chart right now, goes out to pay claims, and a very, very small piece goes out to pay administrative fees. When you look at claims and stop loss insurance, over 95% of our money that we bring in pays direct benefits for our members. That's only leaving a little bit over, 4 to 5% pay administrative fees to Excellus, all of our internal fees and consultant fees. That is a very efficient plan, which we're very lucky to be part of. Stop loss insurance, as we talked about, that is also a mechanism that we use to feed our catastrophic claims reserve. Right now, what we do is each year we go out and seek quotes for stop loss insurance with 2 deductibles. One of the deductibles is $1 million stop loss deductible plan, and the other is a $600,000 stop loss deductible plan. What we budget for is the $600,000 stop loss deductible plan. And the reason we do that, if we ever get to the need where the business decision needs to be, we need to lower that deductible, because now we're starting to get a significant number of claims over $600,000. We're not going to have to make a large increase into this budget line item. But we also wanted to utilize that to benefit this group, to protect us from those claims that don't fall, over $1 million, but are big claims that are over actually $500,000. So when you look at this estimated actual number here of only $322,000, and I probably should have made this a little bigger for you. Hopefully that helps. Sorry about that. So when you look at this estimated actual of $322,000, you'll see that we had budgeted $872,000. Again, we budgeted for a $600,000 claim deductible policy, but we only bought $1 million deductible policy. So it's a lot less expensive. So what we did for the outlying years is we projected a 10% increase on stop loss based on the quote we got this year for $1 million, or excuse me, for the $600,000 policy. And that's what's grown on the outlying years. Again, focusing just on the 2024 year, but that's how we trended that out. Current quote, increase it by 10% as a projected number, and then carry that out to the outlying years. Again, the rest of the numbers, any questions there? I know I'm moving kind of quick, but I'm going to explain how we utilize that just quickly for the catastrophic claims reserve. So down here, and then I'll come back to and talk about rate stabilization. We have our catastrophic claims reserve. How we fund that catastrophic claims reserve is we budgeted $872,000. We spent $332,000. We're going to take that extra $550,000 and we're going to put that in the catastrophic claims reserve. And then you may say, well, that would just build up the pot of money. Well, what we do after that is we look at any of our claimants that actually incur claims over $500,000, not the $600,000. We actually bite off an extra $100,000. If there are any claims that fall between $500,000 and $1 million, we take money out of that reserve fund to help soften the blow to the actual year of activity. So that's an entry that we do at the end of the year. We track it. We have a little tracking device that tracks it. This year's kind of interesting. We talked about how few of the claimants we had that spent, the claims total $4.5 million. Right now, our largest claimant is at $341,000. So what we're seeing is, on top of a smaller number of claimants driving a larger claim number, we're also seeing a lot of those, I call them chunkier claims, for lack of a better word, those 75,000 claims, those 85,000 claims. They're not even hitting that large loss chart that we provide to the group each month, but there's just a little higher claims. And some of that is obviously technology gets better, treatments get better, inflation creeps in. So we're just having that tough year right now as we talked about claims. So we put money in by funneling it through this stop loss insurance line. We take money out for those claimants that are over 500,000, but less than $1 million. And then we add to it any interest earnings, obviously that's tied to that reserve fund. So that's how the money moves in and out of that catastrophic claims reserve. And that's why we feel comfortable by having that reserve fund. So right now, it's a good business decision to buy the cheaper stop loss insurance policies, because we're just not going to have the benefit of we would get if we bought $1 million, we would get no reimbursements for it. Right now, we don't have any reimbursements to date, even on a $600,000 policy. So to get a reimbursement for stop loss from your stop loss insurance, if you have a $600,000 deductible, the group is responsible for the $600,000, first 600 for any claimant anyways, and then $600,001, then you start getting reimbursements. So right now, the business decision has been solid for the past few years to utilize this model. And that's the direction we're looking at moving and continuing for 2024, based on where we are right now with large loss claimants. Any questions on that? I know that was a mouthful, and hopefully I said it in a manner that was understandable. I know it's I get rolling a little quick sometimes. So if we're good, I'll just move on and talk about where we think we're going to end and why we're recommending 8% up here, 8%. And again, not voting on these when we approve the budget, but just a game plan. 8%, 775, 75, 75, 75. Again, the rest is just administrative fees. There are some larger expenditure line items that are built in the current year for furniture and fixtures. They talked about moving into a new building, so they're in the process of getting that set up. You know, those are more likely one-time expenditures at a larger number, and then we'll drop down a little bit. You'll see like 75,000 here. You know, we're projecting they'll spend the whole thing. I don't know how the shopping's going, but that's such an insignificant piece of the budget. But we just for now estimated actual, and then you see that drops back down. But again, these numbers don't drive this 8%. It's all claims. What we think we're going to get in RX rebates, and then how much premium revenue do we need to drive. You know, not saying that this is nothing, but it's a very insignificant piece. So based on those projections and where we are and what we've seen through August, we're looking at expenditures of 68.8 million, and our revenues only 65 million. Again, we hope that that's very conservative and things improve, but that's going to show where we budgeted a 1.395 million loss. We're looking at 3.6 million. And again, we think there's some good things on the horizon. We think we've made some conservative estimates based on trends. But next year we are recommending that we utilize a little bit more of that fund balance, but at the same time, we're going to budget a little bit of a net loss, but we're also going to reduce the rate stabilization reserve. All these in red ink right here, it means we reduce the reserve for those years to 2.5%, as you can see over here. The green year, we're going to start inching our way back up. We're moving it back up to 5%. And then when we're in the black font, we're back at 7.5%. So the game plan is by utilizing this, and hopefully all of this pharmacy integration generates the savings. This year, it is just an anomaly year that you know, we do have a little bit more of high cost claimants, even though there's fewer of them, dollar volume, that's high, that this game plan of doing 8% this year and then starting to taper it back a little bit will come into fruition. Then next year we would have a budgeted net income of 1.2%, and then a budgeted net income of 2.9, 3.9, 5.2, and we're back into, you know, a comfort zone. One of the other targets that we always talk about is trying to retain an unencumbered fund balance of 12% of our premium. So we see we fall short of that, you know, a couple of years, but then right there in the third year, even though we're at 2.5% of our rate stabilization reserve, we're back at 12.2. We move it back to 5. We're at 12.29. We're back at 7.5. We're at 13.66. So again, long-term planning, only focusing really on the budget development for next year, but it is important to have a game plan moving forward. Another thing that, you know, some people get a little nervous about that, I always like to look at what do we have in our discretionary reserves, these in the blue with the yellow lines, and our undesignated fund balance. We do have over or nearly 20% in each one of these years. So we're not in dire straits by any stretch, but it is a time to proceed prudently and cautiously. And obviously, if this year ends up being a super year, these numbers can change on the outside. There's nothing saying that. But I think what we're looking at is let's be cautious. Make sure we have the revenue to support ourselves, utilize the reserve funds that were put in place for this very particular purpose, and try to balance things between reserve utilization and premium rate increases that may not be comfortable, but we can get by with them for a year or two to make sure that we right the ship and this corrects itself. That was a very lot of information as quick as I could without trying to go too fast. So I'm more than willing to answer any questions that anyone has. And hopefully I didn't put you to sleep or lose you along the way. I didn't check the chat. I don't know if anything's up there for me or not, but
Paul, I just want to say, this is Ian Tompkins. I just want to say that was a great presentation. It was actually quite clear, even though you went pretty quick, and I think it makes a lot of sense. So thanks for your time and energy.
I appreciate it. Thank you.
Gary.
I'm taking Paul off. Sorry, Paul.
Okay, well, I'm gonna
There
make
you go.
this. I'm gonna make this really short about the DFS and all of our audits that are going on, because I know that Kylie's piece is a little more important. We can get into the audit further down the road if we need to, or when we need to, I should say. So we are being audited by Department of Financial Services. It is a 5-year audit. They're auditing us from 2016 to 2021, which is a standard audit for them. It's a 5-year audit. They're just a little behind because of COVID. The main focus of our audit this year is risk. So that includes cybersecurity and financial solvency. We're so far have received 6 financial recommendations from DFS. I do have them all, but I'm not going to go into them now. But at the end of the day, I think one of them may affect the directors. Specifically, we may have to go back out to all the directors and have an approval done, but we need to fight that fight with DFS first. It just came in this week for that recommendation, so we won't know for sure on that. We did have an IT portion of the audit, where they were mostly looking at our cybersecurity and some of our approval processes to have new members added to Excelis's website and how we do enrollments and that kind of thing. They have come back. Most of the findings that they have is all about our lack of cybersecurity policies. Most likely we have them. We have the processes in place. We just don't have policies to back up the processes. And we will be looking to hire an outside firm to guide us through and become compliant on all that we need to for the cybersecurity piece. It's not that Tompkins County can't always handle it. They do handle it for us, but because we have HIPAA regulations, we have Article 47 regulations, we have insurance law regulations, and we have municipality regulations, they don't have anybody at Tompkins County that knows all of that. So we will be finding somebody that knows all of those different regulations to help us stay compliant. Medical and prescription claims audit. I think Bud usually is handling these, but I'll take it over for him. We did an RFP, I want to say last year, and BMI Audit Services, who we've used for a while, did retain our business. They were awarded both the medical and the prescription claims audit. So medical claims audit, we're currently in the process of doing a fiscal year 2021, 2022. And prescription claims audit, we will be starting shortly, but that's going to be for fiscal year 21 through year-to-date 2023. And we will be auditing ProAct for that, which is why we're doing year-to-date 2023. The Claims and Appeals Committee will look at those final reports. It then goes to the Executive Committee for final review, and they approve the results. So those do not go to the board, but just letting you know that they are happening. That was my short and condensed version.
That was great, Jerry. Good job, Jerry. Before I dive into plan changes, were there any questions for Terry on the audit, DFS, anything like that? All right, I'm gonna cruise right along. So prior to January 2023, the way that we handled drug formularies is there was an update every January and every July of each year, where the formulary was reevaluated by our prescription benefit manager, and they advised us of any formulary changes. An act that was passed late in 2022 for New York State, and we do follow all New York State mandates because we're in Article 47, was to implement what's called a frozen drug formulary. And this means that we do not make changes to our formulary mid-year. So what that means for us is we can still add new medications throughout the years. They are approved by the FDA. It just means there can be no changes that result in a negative impact, meaning we can't add prior authorizations to a medication that didn't have an authorization requirement prior to January. We also can't shift medications from a tier 2 to a tier 3, but they could be shifted to a lower tier if necessary. The other thing is we can't remove any medications from the formulary unless the FDA rules that the medication needs to be removed from the market entirely. So what that means is I've had some phone calls from benefit clerks asking where the July formulary is, because I know that's what we've been used to for so many years. There is no July formulary. We only go off the January formulary. So that is why still on our website, you'll see the January formulary. So any updates to our formulary will happen January 1 of 2024. If there are shifts and changes, which if we shift to Excelis, there will be changes in our formulary. As a result of a frozen drug formulary, the consortium may be seeing higher drug costs because those tiers and authorizations or lack thereof are locked in place for the entire year. So that might be part of the cause of some of our prescription claim increases, which we're mandated to do. The other aspect is every year we have to do, thanks to Lucy and Cahill, they do it for us, an actuarial value calculation to make sure that our metal level plans are in compliance, which means they have to fall within certain ranges. And I've listed those here. I'm not going to read them all to you, but essentially what was determined is our platinum plan is still in its correct actuarial value range. So is our bronze plan, but our gold and our silver plan, unfortunately, are not in compliance. They're a little bit outside that percentage range. So therefore, we had to look at adjusting the benefits to our gold and our silver plans. So our silver plan updates for 2024, and this is not official until it passes through our board of directors meeting September 21st, but I'm trying to get the information out there early so you can plan on talking to your employees early and plan accordingly. So the silver plan deductible is going from 2,750 individual to 3,000 individual for in-network. It's going from 5,500 family to 6,000 family for in-network. And then the out-of-pocket maximum for in-network is going from 7,000 individual to 7,500 individual and 14,000 family for maximum out-of-pocket to 15,000 family. That's for in-network. The out-of-network is also adjusting, as you can see on the chart. The other big difference for out-of-network is it's shifting from a 50% co-insurance to a 60% co-insurance. And as we go out and we meet new municipalities interested in joining us who may already have a silver plan, this is more and more the benefit we're seeing. Where the silver plan may have an 80 to 70% cost co-insurance for in-network, but for out-of-network, it's a standard 60%. So that way our silver still stays competitive when we're comparing it to new members as well. So as you can see, it changes that actuarial value from a 72.68%, which we're at right now, which is over that limit, and shifting it down to the 71.50 0.57%. So putting us back into compliance for 2024. The gold plan was also updated. So for deductibles for single, it's going from a $1,500 deductible to an $1,800 deductible. For family, it's going from $3,000 to $3,600 for in-network. Maximum out of pockets for in-network are going from 3,500 individual to 3,600. And family is going from 7,000 to 7,200. There's also shifts in the out-of-network deductible and maximum out of pocket, which I don't think everyone wants me to read every line item to them, but there are some shifts there as well. And there is no change in the co-insurance amount. So for in-network, once the deductible is met, there's 80% coverage with a 20% co-insurance for out-of-pocket. And then for out-of-network, it's a 60% coverage with a 40% co-insurance. By making these shifts, we're going from an 82.55% actuarial value down to an 81.38, which puts us back into compliance. These are the only two plans across the consortium that are experiencing any type of benefit change. Any questions on plan changes or frozen formulary or anything along those lines? Okay. So one of the approaches that we took in 2023 is to be more competitive with our retiree options. We were requested to look into Medicare Advantage plan options, and I just wanted to take a moment before we jump into that topic to just briefly discuss. We are continually still offering the consortium Medicare supplement plans. We have two available, the MS3 and the MS4. Both of them cover the exact same way. So original Medicare pays first, Medicare supplement plan picks up all the co-insurances, co-pays, and deductibles after original Medicare. The only difference is the prescription drug cost. So with the MS3, it's in order by tier. So tier 1 is $10, tier 2 is $25, tier 3 is $40. And then the MS4 prescription drug cost, tier 1 is $15, tier 2 is $30, and tier 3 is $45. We have multiple municipal members on these plans already who are very happy with them, and they are still an option. These are plans that were designed by the consortium and also have the premium rate stability of the consortium. We also wanted to offer Medicare Advantage plans. They're the new and upcoming thing. They do receive a certain amount of federal dollars, which is why their premiums are less. There's no guarantee on how long those federal monies will be there to support Medicare Advantage plans, but it is there. And Medicare Advantage plans do offer some incentives or additional benefits that you won't find on a Medicare supplement plan that make them more enticing for retirees. So earlier this year, we went out for an RFP. We compared multiple Medicare Advantage plan options, and the decision was made to contract with Aetna to provide 3 different plans available to all of our municipal members. It's the PO1, the SO2, and the CO4. So the PO1 plan is most comparable. The PO1 plan is kind of like the middle of the road. So the SO2 is comparable to our platinum plan benefits, very similar. So an easy shift if you're on active platinum to shift to the SO2, the copays are going to be very similar. The CO4 plan is very comparable to our Medicare supplement plans and are very competitive with the classic blue plans. So if you have actives on this classic blue plans, or if you have current retirees on the Medicare sub plan, this would be a comparable plan to look at. The PO1 is a nice middle of the road where you are going to see some copays, but for those higher ticket items like inpatient hospital stays, there are no copays. The way these Medicare Advantage plans work, they're not the same as going on the open market to pick a Medicare Advantage plan. These are large employer Medicare Advantage plans where we help select the benefits for them to be more enhanced than what you can get on the open market. All of these plans have what's called donut hole protection. So they're going to have consistent copays for their medications throughout the year. Whereas a standard Part D plan on the open market with Medicare, your copays could fluctuate depending on how expensive your medications are. They also offer some enhanced benefits such as routine eye exams, eyeglass allowances, hearing exams, hearing aid benefits. They even have meals that'll ship to your home after an inpatient hospital stay, and non-emergent transportation if you need help getting to doctor's appointments. So they definitely have some enhanced benefits. I'm not going to go over every single benefit they offer because I know it's in your agenda packet. I will say that if you are interested in me doing a plan comparison for you, or talking benefits for you, or you want to meet virtually or in person to chat Medicare, I feel like I've talked Medicare a decade of my life. So always open to those conversations, and feel free to check out those options. Now, where we earlier gave you the time frame of October 15th to let us know if you want to add plans, change plans for 2024, Aetna lives by a different set of rules. They have to follow CMS rules of they have to issue notices at a 30-day and a 60-day and different timeframes. So they're asking by September to make them aware if you're interested. They did not tell me if that's the beginning of September or the end, so I'm going to pick somewhere in the middle. But please, the sooner the better. Let's leave it at that, to let me know if you're interested and we can start working on those next steps. Are there any questions on Medicare Advantage plans? All right.
Great, and I think an important thing to mention about the Medicare Advantage plans, although we won't go into great detail on it tonight, is when a municipality elects to join a Medicare Advantage plan with Aetna, they are taking part of our risk pool away. So we're shrinking our risk pool, which has an effect on our actives. So as you make that decision, we have to think about the consortium as a whole, and there will be more conversations on that as we get more involved with offering Medicare Advantage plans. All right. Ed Fairbrother is not with us tonight, so I'm going to give a quick update because at the board meeting, you will be asked to select your officer and committee members for 2024. We have seen that there are some committee members that are retiring, leaving, that will be leaving the consortium with that retirement, and or just switching hats. So some of the seats are changing. And as a result, we've been able to add some new committee members from counties where we haven't seen participation before. Those individuals are on the screen in front of you right now. I'm not going to go through it step by step, but we do still have some vacancies in a few different committees. We may have an additional vacancy on the operations committee, as we do have a member who claims they're retiring at the end of the year. So if they do, we'll probably replace them as well. So this is just an opportunity to say, one, be prepared to vote on a slate of officers and candidates at the board meeting, but also if you miss the opportunity to fill a slot and you'd wish to fill that, please let us know. Several individuals that are new responded to our survey that we sent out, and we appreciate you doing that. So we were able to put your names in some of those empty positions. So thank you for volunteering. and look forward to working with all of you next year. We may change some committee times and things like that in 2024. And as you see, we split the audit and finance committee into two separate committees. That was part of Terry's DFS recommendations from that we had to treat that a little bit differently going forward. So those are there. If you see a vacancy and you want to join us, please do so. All right, as we wrap up this long agenda, there are some additional benefits that we are bringing next year to our members. Some were requested, some we felt we could help you with and went out and shopped for, but there are a few things we want to make you aware of. There will be a informational session on the first one, which is COBRA administration. We have just passed a resolution at the executive committee level that we will be doing COBRA administration in 2024 for our small municipalities. So any municipality with 50 or less members or employees, less than 50 employees, we consider a small group, and their COBRA will be administered through Lifetime Benefit Solutions. So we're sending out information on that right now. And it's going to be pretty easy. You terminate through Excelis right now. That information will feed to our COBRA administrators, Lifetime Benefit Solutions, and they will take over notifications and communication with the exited employee, and then they will take over billing as well and send those payments to you. So when Terry bills you for their COBRA, you'll pay us. So that'll be helpful. We've heard from some benefit clerks who either have not been administering COBRA, didn't know they had to, or lost that service when they came to the consortium, or want to get rid of doing those notifications. So that's an enhancement the consortium is making to our offerings for our small groups. If you're a small group, you are on this chart, and your COBRA administration will be taken care of for you. The light groups on here, those are just our new members. So we have everybody else alphabetically, so you can see if you'll fall into that area, and there will be more information coming from Kylie on that whole process. Next is the Joint Committee on Plan Structure, Joint Committee on Plan Benefit Design.
Plan structure and design.
It's late, it's getting late, and we're gonna wrap this up soon. I can't even talk. Asked us to increase mental health services and access to mental health services by way of getting discounted pricing through a shared service on employee assistance programs. So we were able to negotiate pricing as a consortium. We vetted through a few different vendors to see what was offered. We decided to go with ESI, EAP. The municipalities will be able to contract directly with them. ESI offers services beyond mental health, including financial planning, caregiving, child support. I think they even have pet support, things like that. So they don't give out pets as support. If your pet needs some additional care, they may be able to help you with that. So we are having an informational session August 30th at 10 o'clock. And you can RSVP for that through Kylie. For those of you who aren't aware, we do have some discounted pricing with Lifetime Benefit Solutions. Thanks to our relationship with Losi and Cahill, they were able to secure us some group pricing. We don't offer management of flexible spending accounts or health reimbursement accounts or health spending accounts. But Losi and Cahill was able to get competitive pricing with Lifetime Benefit Solutions that we can pass on to our members. Once again, it's a direct contract with you and LBS, but more than happy to share information regarding those services with you in case you want to garner some additional support in those specific areas. If you don't know or wondering what the heck happened to our newsletter, it's now totally online. You can receive it straight in your inbox. Some people still receive it through their employer, which goes to their email. So when I say inbox, your email inbox. So this gives you a little information on how, if you're not getting it, where to find it on our website under the tab current newsletters. So you can click right there and read up all these changes that we're making. We try to communicate them not only to you, but also to all our members, and keep our website updated with information for those who come in are kicking our tires and looking at what kind of information we share. So it's pretty easy and quick how to register, as you can see in the lower left. I encourage you to do that to make sure you stay connected with us. Do we have a Facebook slide? Or we also have a fantastic Facebook, and I'm not on Facebook, so I have to get it through a report. But a lot of the wellness programs, some of the additional informational webinars that are strictly volunteer, that's where we advertise it. And Kylie is putting a ton of content on our Facebook page, our wellness challenges. People are sharing information about where they're hiking, how their mental health plant is doing. And it's a way to not only be connected with other people that are going through the same type of things that you're going through, but also a way to get information on how to deal with what you're going through. So we have specific goals of members we want, likes, and people joining us on our Facebook page. So if you have not done that, please go ahead and do that, because there is great content there, and I don't think you will be disappointed. All right, so with that, try to get it in before 7. We're 3 minutes late. I will turn it back over to Gordon in case you have any questions or feedback regarding this session. Oh,
Does anyone have any thoughts, comments, or questions for any of us?
Our board meeting is wrong on the agenda. It's September 21st at noon. Last year it was on the 22nd.
There's a nice invitation within the.
Yes,
agenda stuff.
the invitation is accurate.
So if there are no comments or questions at this time, of course, everyone remember, if you do ever have questions, Elin and staff are available to field them. I also am happy to field any questions that any of our municipal partners might have, specifically with respect to the municipal participation portion or piece of consortium membership. And if you have any questions about, as I mentioned at the beginning, if anyone is potentially interested in committee memberships or taking a slightly more larger role or participating at a greater level in the organization. If you have questions about what that might entail, I'm certainly happy to field those questions as well. But if there are no additional questions right now, I certainly want to thank everyone for coming. As Elin mentioned, it is Thursday, September 21st at noon at Greek Peak, and you'll certainly be receiving some reminders between now and then. We do need an in-person quorum, so please plan on carving out a couple of hours and making the trip. So thank you everyone for being here tonight. Look forward to seeing you all in person in just under a month.
Great, thank you.
Good night. Thank you.
Have a good night, everybody.
Thank you.